This project could not have come to fruition without our dedicated and outstanding supportive partner consultants. I would just like to briefly acknowledge their outstanding work throughout the process. Sophia from AfriPads, we had Diana Nelson from Days for Girls, Neville from the African Coalition of Menstrual Health Management, Mariana from Madami. Madami provided us inputs during this consultation from a parallel study that they were running with key stakeholders from the manufacturer group. These insights were incorporated within the study that will be presented today. Please keep an eye out as this parallel consultation will be made public in September to reflect the voices of the community. Last but not the least, I have supported this project as part of Development Solutions supporting Tanya Mahajan. We'd also like to acknowledge within RHSC the Youth Caucus for providing the initial impetus to the project through the Innovation Fund, the new or underused RH Technologies Caucus, where the Menstrual Health Workstream currently resides, and the Advocacy and Accountability Working Group, who have helped us take this work forward for joint advocacy. Next slide. The methodology for the project primarily included qualitative data collection with in-depth interviews with manufacturer groups, advocacy groups, and technical experts, many of whom you'll be hearing from today. We also incorporated insights by secondary review of standards and LMICs by examining standard documents available and supplementary notes from regulators and national standard agencies from within target geographies. Next slide. A quick brief discussion of the agenda today. I will be taking you through the overview of the standards landscape that has been put together by our primary and secondary research. The next part of today's webinar will be a presentation and panel discussion bringing insights from several subject matter experts on process lessons and technical specifications that exist across LMICs under study. Lastly, we'll open the floor to our audience for Q&A session. Next slide, please. Thank you. As part of the study, one of our key deliverables was to understand how standards exist and what kind of standards exist across LMIC countries in South Asia and Africa. The next slide, please, will demonstrate that standards are needed. This came out in our conversations across stakeholder groups within the trade manufacturing industry, the consumers, as well as governments, where standards are a multi-pronged way to address several approaches. On the consumer front, it is important that our consumers have access to quality products through the open market, and they're better positioned to assess the quality and access redressal mechanisms. This cannot be possible without standards in place. From the manufacturer's point of view, it is important that we create a framework for market entry for new categories, for example, reusable products, which currently acts as an impediment for the lack of standards. We can also include all product categories within policy discussions to unlock government funding on taxation, free distribution, and other things, which are traditionally focused only on disposable pads if we have standards in place for reusables. Cost of giving further goes down as governments, donors, NGO programs can use national and international procurement standards for free and subsidized distribution. And last but not the least, perhaps it's critical that we have a common definition of quality. Products, it's evidence that products with a stronger quality control have a competitive advantage in the market. It also allows for free flow of products across regional and international borders, thereby reducing the cost for customers. All in all, there is an urgent need for standards, and our study helps understand how these are being currently used, formulated, and implemented. Next slide, please. The standards landscape was a key deliverable of this study, where we diligently studied existing standards in LMICs in South Asia and Africa. We have collated a database of 27 standards in the disposable category and 14 in the reusable sanitary pads category. This public document is now available on the RHSC website under the Menstrual Health Supplies Workstream publications. I will quickly share some key insights that we collated during this exercise. Within the African region, most standards, 8 of them to be precise, exist in Ethiopia, Kenya, Malawi, Tanzania, Uganda, South Africa, Zambia, and Zimbabwe. And this has been attributed largely to the joint advocacy by the ACMHM members, which has pushed the efforts forward in this region. In the West and Central African region, we still see a need for further advocacy, but this is already starting, with Ghana already working on reusable sanitary towel standards, and Ghana and Nigeria already having disposable standards. In the Asian region, we see that most South Asian and East Asian countries do not have published standards. Only India has reusable patch standards. There is definitely scope in this region as well for strengthening joint advocacy. South Asia and the ASEAN region overall can be potentially a separate focus area, given each region has very specific trade associations. During our primary conversations and secondary reviews, we could not find a lot of data in the LATAM region. Interactions show that there's been limited advocacy efforts, and most products currently are being imported across countries. Next slide, please. There exist industry standards like INDA and IDANA that most large-scale FMCG manufacturers refer to. However, within our interactions, we've seen that national discussions seldom include them as reference documents. The Man Global study has presented some insights on how trade flows affect supply chain. And we've seen that Japan and Chinese products may be required to be given a high, given that they have a very high degree of product flow, it is important that some of these standards are also included within national and international harmonization and implementation discussions. Technical exchange with experts from the region is also limited to LMICs, despite the high level of product flow from some of these rather developed Southeast Asian and South Asian countries to the rest of the world. Next slide, please. I'd like to now hand it over to Tanya Mahajan, who will be leading the presentation and panel discussion.
Thanks, Sumati. Thank you for taking us through the overview of the landscape of products. Now we will go into really understanding some of the insights from our interactions with various stakeholders. And to supplement that, we also have a really interesting panel, some really informed experts who have contributed both to the study but also continue to do advocacy in their regions on standards. We have with us, if you could go to the next slide, please, Madison. We have with us Mr. Sipivo Matshoba, who works in the Department of Women, Youth and People with Disabilities and helps oversee the Sanitary Dignity Implementation Framework. This framework serves as South Africa's menstrual health policy. He represented the government at the washable standards meetings and contributed to the discussions that the Bureau of Standards in South Africa led to draft and then harmonize the washable standard for South Africa. Welcome, Mr. Matshoba. We're really glad to have you here with us today. We also have Dr. Michael Mosherosh. Michael is the Director for R&D and also Fellow Social Innovation at Johnson & Johnson under the Consumer Division. Michael has over 25 years of experience in product development for the consumer healthcare sector with expertise in technology transfer and adaptation and environmental sustainability. He's also been the program manager for J&J's Africa Innovation Challenge with a focus on incubating healthcare startups in sub-Saharan Africa, one of note being ShePads. And Michael has provided some really great insights on the technical aspects, technical specifications as part of the study. Welcome, Michael. We also have with us Danielle Herman, who's the Humanitarian Supplies Analyst with the RTSU under UNFPA's Humanitarian Office in Geneva. Danny's role sits at the intersection between program procurement and logistics, working to ensure that UNFPA can operate an effective supply chain management system in humanitarian settings. She's also the co-founder of the Global MHM and Emergencies Working Group and co-chairs the Global Humanitarian Health Supplies Group with WHO. She's also the co-lead of the IAWG Supplies Sub-Working Group and is the Global Logistics Cluster Focal Point for UNFPA. Welcome, Danielle. We also have with us Shivani Swami. Shivani has been working at Livingard, a Swiss-based life sciences company, for the past 7 years on sustainable health and hygiene solutions. She's led the design and implementation of Livingard's menstrual hygiene solution, Safkins, which is a line of reusable, washable, antimicrobial pads and period panties. But of note is also that she supported the development of standards for reusable sanitary pads with the Bureau of Indian Standards in India. Welcome, Shivani. We have with us Sophia Grinwolds. Sophia is the co-founder and director of AfriPads. AfriPads is one of the world's leading social enterprises in reusable sanitary pads with operations in Uganda and Kenya. And the company has grown under the leadership of Sophia with over 175 employees and has distributed over 4 million products across 40 countries in Africa, and was most recently honored with the Power Together Award by the Women's Political Leadership Forum. Welcome, Sophia. Last but not the least, definitely, we have with us Neville Okwaro. Neville joins us as a representative of the National Wash Hub at the Ministry of Health of Kenya. He's a true menstrual health champion and has supported the development of Government of Kenya's MHM policy and strategy through the Ministry of Health. He's also supported the development of the MHM in Schools Teachers Handbook, the MHM M&E Indicators and Train a number of government officers across countries in Africa and Asia in his role as a trainer with WSSCC. Neville is also a member of the leadership committee of the African Coalition of MHM, the Global Menstrual Health and Hygiene Coalition, and the Global MHM Measures Group. Welcome, Neville. Next slide, please. So to kick off the discussion, we have, like Sumati mentioned, we have both process lessons and lessons on technical specifications. But when we talk about process lessons, there are, people often think that standards is limited to standards creation, but that's not really the case. So this graphic just sort of visualizes what the overall process is. So first of all is essentially trying to understand how we can make the case for developing standards with the right stakeholders in the government, because that's essential for not just development, but overall compliance to standards post-creation. Then comes the actual process of standards creation, where the regulatory authority puts together a committee, deliberates on the technical aspects, and puts together a draft, which is eventually published. Then comes the step of dissemination and enforcement. In many cases, the standards for menstrual products are not mandatory, they're voluntary. So under that case, then enforcement requires many other activities, which we'll talk about later based on our experts' experiences as well. And last but not the least is the piece of harmonization, which again, we'll talk about it in detail, but just to point out that the variance in standards according to the landscape study that we did was immense. No two standards look alike. So there is definite need for sort of looking at how we can bring together a common definition of quality, which really does not exist right now at the global level. Next slide, please. So the first point, which is making the case for standards, one of the key things there is government stakeholders and champions. Government stakeholders really can find windows of opportunity for making the case, and help us understand how we can support the goals of existing ministries or departments within the government, make a formal request for standards to the regulator, leverage standards for inclusion of product choice in policy, leverage standards as a means of market development and restricting poor quality products to consumers, and also support large-scale procurement that often government does. In this regard, I want to pose a question to Mr. Matshoba here. Mr. Matshoba, your department in South Africa has played a key role in adoption of the SAB standard for washable pads. Where did you see the key windows of opportunity, where you could push the adoption of washable pad standards in South Africa?
Thank you very much, Program Director. It's good to be here. Well, for us, it was really to ensure that society, especially menstruators, are aware of product choice, product mix, so that within the array of available menstrual products, they can be able to make a choice, and a choice that is not enforced on them, and also to democratize the menstrual health issue, so that people are not straitjacketed to a particular product. And also we knew very well as government that if you are to pursue this, you need to ensure that, yes, there's a product mix that ensures product choice, but central to that should be product safety. And the best way to ensure that there is indeed product safety, because once we have product safety, then you have the credibility of that particular menstrual product, and that you are giving an avenue for a menstruator without any equivocations to be able to actually access and use that particular product. And in as far as the reusables and washable sanitary towels are concerned, we first introduced this a few years back, but as you know, this is always a process. And we are acutely aware that in the South African context, although you do have an array of menstrual products, be they disposables, reusables, the tampon or the cup, but well, I guess it's just circumstance, that it tended to be that the disposables become the products of choice. We have no qualms with that, because they were there, they were available. But what we're saying is that we need to broaden choice. It's very important, because you also broaden availability, and also the most important thing is that also you have to make it a point that out of that, it teaches you as government in terms of, once you are involved in a sanitary dignity program by giving free menstrual products to menstruators, how do you actually work within this product choice regime, so to speak? So that is why then, lastly, not to take much of your time, to say we then had to sit with the South African Bureau on Standards and ensure that we sit with manufacturers, distributors, and all people that are in the menstrual health space, so to speak. And then we had to agree as to what is the basic minimum standard that we can actually all be comfortable with, so that we know that this is basic minimum. You can't go beneath this, right, as far as the standard is concerned. But of course, with innovations, you can make the best reusable sanitary towel, based on your own innovations and creativity. But there has to be a basic minimum standard so that we protect menstruators from illicit and undesirable products that ultimately harm them. And then we as government have to carry that responsibility. Thank you.
Thank you, Mr. Machuba. That was really well elucidated. I think the focus on choice and offering choice to consumers, particularly choice of quality products, but also a wide array of types of products, is well noted. And it's really encouraging to see that government is actually taking that up in such a focused manner. I also wanted to really ask you, did COVID open up opportunities to bring in this choice, given that, disposable sanitary pad supply chains were a little bit, how do we say, locked up? So did COVID offer a window of opportunity as well?
Oh, yes, it did. It did, especially during the COVID-19 pandemic at its most extreme period. In actual fact, it allowed us to gauge the acceptability of the other menstrual products, so to speak, because what we decided to do was to partner with civil society and other players, and actually work together in rolling out these products. And as we're doing that, we're obviously, in a very subtle and intrusive way, gathering information in as far as what is the acceptability level. Because also, it has been more anecdotal, and it's also understandable in the sense that some people had a little bit of doubt or reticence in as far as the reusable is concerned, because the concern was mostly on the issue of absorption, the ability for a reusable to really absorb and sustain a menstruator throughout the process of schooling, from morning to afternoon, So we began to interact and engage the menstruators at school level to find out what is their taking as far as the shape, the design, absorption. And in fact, contrary to their doubts and expectations that could have been initially negative, they were more accepting and actually began to realize that, wow, this is another avenue, right? Now we can decide, because that's the most important thing, that, it gives them that ability, that bodily liberty to decide on what a menstruator is comfortable with, not to be just born and straight-jacketed into a particular product. So this is something that is exciting us, and we're still doing a lot in as far as actually, reaching out the length and breadth of the country. But I think one of the most important things that we got as a feedback was that, one, the perception before was that people would link a rewashable with the old ones that were used by our parents or grandparents, and actually imagine and visualize even the quality. And also, South African young people are very impressionable, often materialistic. So they don't want to be associated with something that is linked to being poor or poverty. But because of the modern reusable and washable sanitary towel, the way it's designed, that is also the beginning of acceptability, that first and foremost, it must be a product that somebody really must be eager or enticed to use. It must not bring the old notion of our grannies menstrual products. So I think that really there's been a great work in terms of the design, the outlook, and of course, as I've said, the absorption. And of course, the fact that now the South African Bureau on Standards has actually issued a standard in 2020, and now manufacturers and distributors now can actually acquire an SABS certification, so that when they trade in these products, the users out there know that these products are safe to use and that there is no inherent danger in terms of them affecting their health.
Great, thank you so much, Mr. Mashuva. That's really insightful, actually, because I think, yes, COVID-19 has shown higher acceptability of reusable products, both menstrual cups and reusable cloth pads. And I think aspiration lies at the core of everyone's desires, not just South Africans. So yeah, we all want good products, but which have minimum viability in terms of how they perform. So definitely standards for washable pads are now needed. Thank you so much. Madison, if you could move to the next slide. Thanks. So this is just a quote from how ISO describes standards. They say that standards are the distilled wisdom of people with expertise in their subject matter and who know the needs of the organization they represent, including manufacturers, sellers, buyers, customers, trade associations, etc., etc. Next slide. So this is just to say that it's very important to really know during the standards development process who is at the table. There is absolutely need to have neutral and diverse stakeholders, because like the definition mentioned, the standard itself, what comes out of it is a synthesis of the people's knowledge who are at the table. So having all types of groups, including SMEs, advocacy groups representing SMEs, researchers and technical experts, even raw material suppliers, users across different SECs is absolutely critical. And here I wanted to ask Sophia, based on your experience of working on standards advocacy across different geographies, have you seen that neutrality and diversity exists, or is there a need for engaging more people in this process?
Yeah, absolutely, Tanya. I think that, one of the things that we've really realized is that there is a challenge of getting the right people into the room. And yet the people who are in the room and on that technical committee developing a standard, they are the ones who will inevitably, shape the standard that is developed and determine the content in that standard and how appropriate and as well as how comprehensive that information is. And, what we've seen is that typically in the 8 standards, for example, that were developed for reusable pads in Africa so far, you have a lot of the usual suspects in the room. And that's the bigger manufacturers, representatives from the Bureau of Standards itself and from government and the NGOs, but the actual experts who can really provide that key expertise, whether it's on the hygiene, so a gynecologist, whether it's someone who can really represent and speak for the smaller scale manufacturers who may not even be on the radar of the Standards Bureau. They're hard to sometimes get into the room, but it's possible if we have that, I'd say very focused goal of getting inclusive representation within a standards committee. So, I think in the Uganda experience, I want to touch on something that our colleague in South Africa just said, which is bias and perceptions. The people in the room, if they're seeing reusable pads for the first time, and I'll speak to that because that's the area where I have the most experience, the perception and the bias of these products as taking us backwards are often limiting the discussion in the room and the content. And yet we see if we have experts, material scientists, people who really understand the raw materials that are key to this product and its performance, if they're in the room, what we can actually see is the conversation and the content of that standard shifting to being informed by fact-based information versus perception. So hands down, the experience across the board has been the challenges of getting the right people in the room, the need to have more advocacy and information at the beginning of the standards process to make sure that those stakeholders are there. And again, that includes advocacy groups, technical experts, gynecologists, raw material specialists, user groups, consumer protection groups. That broader scope will make sure that the standard that is actually developed is going to be appropriate and suitable, not for the short term, but for the long term, even leaving space for innovation. So this is really key, I think, to seeing standards that are developed in a way that that can meet those key criteria. But there's a long way to go, and I think that some of the key challenges are really around identification of those experts, knowing if they're there and available in the country, and if they're not, perhaps in this world of Zoom, we can start bringing them into the room in a way that we didn't do in the past, as well as the cost implications. Is it's typically the Bureau who covers the cost of convening the meeting, but not able to, per se, cover all the costs of getting all of those members in the process throughout the entire development process. So work to be done, but I think we've learned a lot through this research about identifying who those key stakeholders should be.
Thanks, Sophia. And I think, like you absolutely pointed out, that one of the critical gaps is that there's not often enough funding to have those people in the room. So to the point of having additional donor support and technical assistance on those issues will definitely be helpful, which hasn't been available till now. I think it's mostly manufacturers who've invested in it, and smaller scale manufacturers, especially reusable manufacturers, don't have that capacity many times. So yeah, absolutely understood. One other area I wanted to highlight was that the secondary evidence is also something that it's up to the people in the room to aggregate, the researchers who are contributing. And often during the standards development processes, we've seen that primary evidence around some key pieces is missing. There's still research to be done, especially on bioburden, on material safety, all of those aspects. So there's definite need for donor support on these areas. Even during the standards process formulation, there's often independent testing required to see the validity of tests being included. So donors can support this process through investing in some of these activities, through advocacy groups who are able to get on the table. And move to the next slide, please, Madison. Yeah, another quote from one of our respondents saying that standards for menstrual products are not unique, and they exist for many sectors, especially hygiene and medical textile kind of sectors. Hence, it's not reinventing anything. So it shouldn't stand in the way of a serious company conducting business. And we say this, next slide, please, because it's often said that we've heard from a lot of stakeholders that it's very difficult for smaller manufacturers to really comply to standards, and so they should be excluded from it. But it still remains that everybody should be in the ambit of being compliant to standards, but how we can promote that is the question. So there's need for looking at going beyond standards creation, how the enforcement can be strengthened, how we can make smaller manufacturers more aware, large-scale procurement agencies more aware, how standard access can be democratized, because right now one has to pay definite amounts for accessing standards themselves. So is there a scope for doing that? There's also need for providing operational guidance and capacity building for the adoption. So for example, I would just take the case of South Africa itself, where with UNFPA's support, a training for manufacturers was organized to support this. And so this is definitely a key missing piece in most countries. Improved access to labs is something that's often missing. And situating standards within MHH policies and not as a standalone thing. Here, I would just like to bring in Neville with your experience with development of the menstrual health policy in Kenya. How did you look at the policy? How did you look at situating the standards within the policy, and how did it really help in compliance in your experience? Neville, are you there?
Yes. Are you able to get me?
Yes.
So one of the most fundamental questions that we've always been asked is, why did we decide to develop a policy? And it's important maybe for us to go back to where we started with the policy development process. In 2016, in the month of May, we launched the Kenya Environmental Sanitation Hygiene Policy. And one of the things that as partners we ensured that was in that policy was the development of a standalone menstrual hygiene management policy and a strategy. And at that time, government was not so much into matters of MHM because it was more of a product-driven campaign. So based on that, partners actually drove the process during that time through the Hygiene Promotion Technical Working Group at the Ministry of Health. So the most important thing that maybe we need to recognize for us as a country, there is always a notion in government that whatever is in a policy always gets funded, which is, it's a rather good statement, but it's contentious in that it is believed that the moment you package anything in a document called a policy, then automatically that ministry is mandated to fund the implementation of that policy. So that was not the case, because even now, after we've come up with a policy, funding has remained a challenge. Then we also wanted to amplify matters of MHM because from the time when we started the development of the policy, so many people never understood what MHM was all about. And we wanted to package all the studies, all the evidences that we had, and even the work that we've done over the years into something called a policy. So when you look at the development of this policy vis-a-vis how it helped the development of the standards, one of the things that maybe is important to report that for us as a country, we took about 5 years developing a policy. 5 years because there are so many vested interests. 5 years because at that time when you are just about to hand over the policy in 2017, we had also initiated the process of development of standards for reusable menstrual management materials. And based on that, the Kenya Bureau of Standards said, even though they will want to develop standards for reusable menstrual management materials, they do not have a basis on which they can rely on. And it forced us to recall the policy to ensure that we've recognized reusable standards, reusable menstrual management materials in that policy. So apart from the recognition, one of the things that we ensured that was so explicit in the policy was giving the mandate and the role of the Kenya Bureau of Standards together with the Ministry of Health, that they are going to lead in the process of development of standards for menstrual management materials. So when we launched the policy in May 2020, the Kenya Bureau of Standards had no now basis on which they can say that they cannot develop standards. Yeah.
Thanks, Neville. That's really interesting that just having KEBS as a stakeholder outlined in the policy and including washable pads as a product then laid the burden of actually developing the standard of that product on them, which is an interesting way of bringing in choice eventually for the consumer. So
true.
Thanks. So in terms of enhancing compliance, have you seen as part of after even standards creation, have there been measures taken to really see that the policy has been implemented or the standards have been complied with through any further activity on the same?
To be honest, sometimes I think we just ended at the development of the standards because there's not so much that has been done. And looking back, the capacity of Kenya Bureau of Standards to enforce these standards is actually a little bit limited. To be honest, issues of menstruation and also MHM are so much shrouded in mystery and stigma to a point that they even affect the development and also enforcement of the standards. Right now, we already had standards for disposables. We already had standards, we now have standards for washables. But when you talk to sector actors, they'll tell you that enforcement has been their greatest challenge. And also at the same time, it's something that is done, let me say, sort of haphazardly. There is no clear, definitive way in which they are going to enforce these particular standards. And the consistency is also wanting. So we might be having these standards, yes, but enforcement is limiting simply because one KEBS reports that they do not have enough funds to ensure that they follow through matters of enforcement. And secondly, they also need human resource, a greater human resource to enforce the standards. And lastly, they also need to collaborate with other actors, in this case, like the Ministry of Health and others, which is also a challenge.
Thanks, Neville. Yeah, that's pretty much what we learned from the other locations that we, geographies also that we saw, especially I think in India, we saw the enforcement issue a little bit more in detail, and literally the same issues are existing, that the sector actors, especially the small scale players and the procurement stakeholders like Ministry of Health, Education are not really aware of these standards and of these regulations. Thank you so much. So one way of supporting this is, again, to promote advocacy in the area, working with regional governments, working with other departments to promote this facilitation, but also to supporting SMEs for better compliance through subsidies, technical assistance, even pool resources. And under MHH policy, support can also be provided to locally grown or women-led businesses wherever the trade focus might be. So those are some of the pathways that can be explored. Next slide, please, Madison. The fourth process lesson is essentially related to harmonization. Now, why is harmonization needed in the first place? So there's a lot of, what we learned is there's a lot of duplication of efforts at country level for standards creation, especially amidst resource constraint. We heard that regulators don't have budgets for much beyond convening those meetings. So then, these efforts then seem like a waste when there are others that can be relied on. Classification also varies across geographies and impacts. Enforcement standards are usually voluntary. They're not mandatory in most cases. There's also high degree of variance in technical specifications across geographies, and this has implications for international trade. So for manufacturers who are exporting to different countries have to comply with different regulations, adding to costs, especially for small scale manufacturers. It's a challenge. And also the lack of evidence and data on key technical aspects is a barrier to standards creation, and harmonization can help pool efforts and solve these gaps which exist currently. There's roles for different groups. Countries have a role to play where regional leaders can take an active role in country level standards development. For example, African Union, the East African Community, standards have been developed by both of these, but they're not really percolating down to the member countries. Countries can also contribute to regional and global standards development. I was hoping actually to have our stakeholder who actually provided insights on this issue from the Swedish Institute of Standards, but she could not join, but she sent an update, which I will just share with you, is that the Swedish Institute of Standards, together with Swedish stakeholders, developed a proposal for new standardization of menstrual products and submitted this to ISO Copolco. And Copolco is essentially the ISO Committee on Consumer Policy and have the mandate to push for standards for specific importance to consumers worldwide. There was a positive discussion amongst the members, which are ISO member countries, about this during their annual meeting. There was also a committee internal ballot to decide whether they should push for this new area within ISO. And there was a strong positive outcome with 55 out of 73 countries voting for having the standards. The comments revealed that countries handle these regulations very differently, some saying there is not enough and some saying that this issue is of international concern. But even countries with sufficient legislation support the idea of having a global standard and participate in the work. Next step will be that there will be another ballot. They don't know exactly when, but they will keep us posted and we will keep everyone posted on this. It will go out to all 165 ISO members and to decide whether they want to participate in this new technical field. In order for the project to be approved, 5 countries will need to approve and nominate experts. And based on this, a new ISO technical committee will be formed. And so we hope to, through the advocacy efforts, push LMIC countries who have very specific requirements to input into this process, which is now ongoing, and actually influence the eventual decision. Coming to multilateral organizations and advocacy groups, there's definite need for joint advocacy and syndicated funding at all levels, country, region, global levels, evidence generation, like I mentioned, and technical support and knowledge sharing. Also representing unbiased user and industry interests, like Sophia mentioned, at the table during standards development, and creating standards for multi-country and global product procurement. Here I would like to ask Danny, with the UNGM coming out with standards for menstrual products, how do you think, how did this come about? How did the whole process of this get initiated? And do you think that wider adoption of these standards can help with the harmonization goal that we are looking at?
Yeah, absolutely. So I think it's an interesting, the way that this came about was really from the humanitarian actors side of a lot of our organizations that participated in the specification development. Due to the nature of humanitarian response, where MHM kind of falls within the coordination structures, is that it kind of crosses a lot of the different sectors of responses between WASH, health, education, et cetera. And this meant that a lot of different actors were providing, varying poor quality products that we were seeing, not just within or not just between organizations, but even within the same organizations. The quality was vastly different depending on whether you were looking in South Sudan versus Afghanistan versus a different kind of humanitarian operation. This, while at the same time we were all serving the same populations. So it raised a really important question. Why are we, as different humanitarian actors, providing the same items to the same populations of different quality? And this kind of led to the question around looking at some kind of common standardization, particularly as UNFPA, as you know, is one of the main health procurement agencies together with UNICEF and WHO. But there was this real big kind of gap in the way that MHM supplies, which kind of fall between medical device and NFI items in this really gray zone area, that we felt that we needed to take a common standardized approach to it. And by making the specification process consultative and then the outcomes public to all, we were hoping that we were able to kind of, within at least the humanitarian sector, encourage partners, whether they're procuring on their own, to either copy and paste the specs that we developed or just do third-party procurement through us as the UN agencies. And then lastly, I think one of the big drives for doing this kind of common standard was that as the purchasing power of the UN is so large, there's a real opportunity to kind of drive the market into the direction that we wanted it to go, not just in terms of quality of the products themselves, but also in addressing some of the wider issues like environmental sustainability and ethical business practices that we really try to push for in line with the SDGs. For example, no applicator tampons and these kinds of really basic reduced single-use plastic requirements and stuff like that. So this was what led to the development of the specs.
Thanks, Danny. That's insightful. And do you see a role for global organizations like WHO, even World Bank in some of these efforts going forward? Because I don't think, or have they been involved in this effort till now?
Yeah, so I mean, just in terms of the process, I mean, there was a pretty significant process done when we developed the standards. One of our colleagues from UNICEF last month was actually on the call who did this technical work together with our procurement branch. But for the 3 items that were the initial focus of the tender, which was the disposable pads, reusable pads, and menstrual cups, there was a huge kind of analysis process that went on, including a market survey and feedback, literature reviews, benchmark surveys, et cetera, review of existing public standards. But then once the initial development of the spec was implemented, it was then disseminated within the Menstrual Hygiene Management and Emergencies Working Group. And this working group includes a broad range of UN, INGO actors, including the main actors that are actually providing these commodities as part of the distribution and humanitarian response. And so I think that what is the role of the kind of wider, I would say, actors? I think that this is where the humanitarian and development space can kind of talk together in a really interesting way, right? Because we're looking at products that we are distributing internationally or locally as humanitarian actors directly to populations. But one of the key gaps that we see is that the vast majority of procurement of our organizations themselves is local procurement. And what are they going to have access to in the local procurement are the quality of the local market. And I think that by increasing the standards that are applicable to the private sector market, we're able to then use alternative models of distribution like cash and voucher assistance if that product that we know on the local market is meeting this common standard. It also helps us to kind of improve the, I would say, environmental consciousness of our interventions and economic kind of sustainability of our interventions, which is what we're always trying to do in humanitarian settings. It doesn't make sense and it's unfair, for example, to provide a super high quality product to a refugee population while the host community around them has no access to that same quality of product. And then as soon as we stop distributing humanitarian aid, their access to that product disappears. So it doesn't make sense for us to do this in isolation. The idea is that we need a baseline minimum standard for our own procurement practices, but if this can be aligned with what's being done and influenced through ISO or these other kind of global bodies, which can then influence the national governments, when we're looking at these decades-long crisis contexts, it's not sustainable to provide in-kind support for decades and decades and decades.
Yeah, no, absolutely. Definitely. And I think there is scope to provide that input now, and hopefully we can, through the support of the advocacy working group, facilitate some of that as well through RHSC.
Yeah, and I think the one last thing I'd like to say is I think the approach that we've taken within the standards that we've developed and why we've also now begin the development of a tampon standard is the idea that was discussed by one of the earlier colleagues. I just wanted to touch on the idea of product choice. And I just wanted to reinforce it from our side. It's really looking at informed choice. And the same way we approach contraceptives, which should, trigger a lot of stuff within RHSC, is looking at method mix. So how do we ensure that in every operation that we're working in, the methods available to the population are diverse, and then the population's knowledge to actually make an informed choice, and not just the choice that's the only thing I've ever heard of, or that's the thing my mother used, kind of drive the market. And in order to do that, we need to have the availability of the items. And so I think all of these kinds of things really speak to each other in a great way.
Definitely, and standards are definitely a pathway to achieve that choice. So completely with you on that. Yeah. Thank you so much. If we can go to the next slide, Madison. So these were a lot of the process lessons. We can just go forward that we've looked at. Yeah, thank you. So now looking at some of the technical specifications, and we don't have a lot of time, but we do have a lot of insights from especially from Michael. So I'll just leave it to him to comment on some of these things. But the key areas where we've got feedback on understood the technical specifications is first is material and design, and which is included in almost all LMICs, but not really in any developed country or any of the guidelines. So Michael, could you comment on whether it should be included in standards, or is it actually limiting innovation? So what's your call there?
Thanks for having me. Well, you're right. I mean, you have to be careful with the standards in regards to not limiting innovation. But if you look at materials, the key aspect essentially is, are the products safe? And that goes back to, are the materials safe? Materials have to be suited for intimate skin contact, and they have to be clean and have to be kept clean during production, during transport, storage, conversion, all that. And manufacturing should be in a clean environment and have documented processes that show how they keep their equipment sanitary and so that how they produce clean products that then in the end ensure the safety of the products for the consumers.
Right, which is what we're talking about, the third point here, the hygiene aspect of it and the safety aspect of it, but not so much prescribing the materials and what materials should go in, etc. Right?
Yeah, I would not necessarily prescribe the materials, because there's a broad range and there are constant developments in materials. What is crucial, though, is that materials are fundamentally suited for the purpose, meaning that they are, either certified or approved for direct skin contact, for an application in a hygiene situation. You can't just use anything that crosses your mind. It has to be suited, and it has to be produced under the appropriate conditions.
Definitely. And so looking at the hygiene and bioburden safety of the product, usually what we've seen is across the product, there's either the pH test that's included, or in addition to the pH test, you have the bioburden testing of the final product. So the microbial load for the final product. So is that appropriate? Should there be alternatives? What's your perspective on that?
Yeah, bioburden is an interesting topic. I mean, let's start with pH. I've never seen the need, and I've never seen really a situation where pH became an issue, right? So that, in my personal experience, there might be cases, but I am not aware of them. Bioburden is much more interesting because it is so much easier to keep the bioburden low than trying to reduce it. So if you're using materials and it goes through the entire supply chain. The materials have to be produced under conditions that are clean and safe. They have to be packaged and transported to keep them clean and safe. And they have to be stored in the facility, in the manufacturing facility, also to keep them clean and safe. I mean, I've seen storage facilities where there was moisture or there were insects and things like that. You need to prevent that from happening. If you keep your materials clean, if you certify right in the beginning, for example, with a certificate of analysis or something like that, that proves that the material meets the specification, and you keep the material clean and store it under clean conditions, and you have processes in place that make sure that your actual conversion at the manufacturing level also stay clean, meaning you have sanitation processes, and how to clean your equipment, you have hair nets, or you have hand washing or disposable gloves or something like that. If you minimize, let's say, human contact of the products, especially, for example, when you do hand packing, then you keep your bioburden very low. And the tricky piece with bioburden is if you keep the relative humidity and the humidity or the moisture content of your raw materials very low, you have very little bioactivity. Whereas as soon as the products get moist, damp, wet, or whatever, that can become an issue. And then trying to mitigate bioburden is hard. I mean, I've seen a lot of operations where they use UV lights to sort of like sterilize, and it's not really sterilization, but to treat or to lower the bioburden. But that only works on the surface. If you have contamination inside the pad, the UV light doesn't reach it, and it doesn't really make a difference. It's so much easier to keep the bioburden low in the first place, rather than trying to mitigate it afterwards.
So more of a process approach than just a final testing approach.
Correct. And the testing, I mean, I think that's actually very challenging, especially in low and middle income countries. If you are requiring a bioburden testing, especially a frequent bioburden testing, that's are there facilities available that can do that for you? That's one thing. The other thing is, the cost, especially for smaller operators, is tremendous. If they can't do it in-house, if they have to outsource it, it's going to really be very challenging for them. Sporadic testing, making sure that your general manufacturing environment and your storage facilities are hygienic, I think that makes sense. But having like a standardized testing for products that are coming off your line, it's not really necessary if your process, how you deal with everything, is done right.
Yeah, no, absolutely with you on that. And that's mostly what's been missing in all of the standards that we've studied, especially in the LMIC context. So probably some additions, modifications needed there.
Yeah, I mean, I think if somebody would come up with a standard and say like, okay, packaging of raw materials for shipment has to be such and such, let's say shrink wrap or whatever, not exposed to the environment, but covered. And then you could even go as far and say like you put in processes and say like the first 2 layers of a material that gets freshly unwrapped gets discarded to make sure that the outer layers are if there's any contamination, that the outer layers are being disposed. Generally speaking, the materials that are being used for disposable products are produced under conditions where you normally wouldn't get any contamination. And if they're packaged and stored properly, dry, clean, insect-free, whatever, they're fine.
Great. That's a useful perspective, because that's usually what's been missing. Would love to continue this. There's so much more to be, unearthed there. There's so many nuances which don't get discussed even during the standards development. But we're running out of time, so we have to move on. I'll go on to Shivani now. Shivani, what is your opinion on? So these are some of the things. These are some of the things that are included in disposables. What are the additional aspects that are included in reusables, or should be looked at for reusable standards as well?
Thanks, Tanya, and thanks for having me. I think I'll start by just setting the biggest contextual difference is that, any test that needs to be done for a disposable product needs to be repeated multiple times for a reusable product. So I think one important thing is for at least the dimension stability and the physical characteristics of the product. They need to be tested for whatever the claimed life is for that product. And it's up to the vendor. I know that across a few of the African standards, there's a minimum requirement of 60 washes. And in some cases, you have players who do less, some that do more, but whatever they claim their product lasts for, they should be testing against that. I think another thing we've been seeing a lot recently is the question of biodegradability or antimicrobial finishing. And I think that whenever companies making such a claim, there needs to be some sort of harmonized protocol or standard that they're held against, and they can't be making a claim just because one of their ingredients is biodegradable or has been known to have antimicrobial properties. There needs to be, if you're giving the consumer that sense of security that that product gives them a certain claim, then it needs to be verified. And then coming a bit to, the discussion of bioburden on reusable goods, I think the history is different because the raw material sourcing process is often different. In some cases, you have people using, using recycled cloth, and in some cases, you have, Ecotech certified raw material sourcing. So there's different kind of raw materials that you might be using, and the hygiene or transport of those goods might be drastically different. And I feel like another point of, another point where there could be some sort of biological activity is in the manufacturing process itself. We're seeing more and more self-help group or small scale manufacturing units that might not necessarily be climate controlled or might not necessarily have the hygiene practices that you would expect in a disposable facility. And so when it comes to yes, the cost is kind of difficult to account for, and I feel like perhaps the solution is to also bring a few more raw material suppliers on the table for both. But we have seen, in fact, in the reusables space, a few products that are commercially sold that haven't passed the bioburden testing on multiple occasions. And so there is a question of, and we have included basic manufacturing unit hygiene or GMP type practices, but where do we kind of draw the line to ensure that there's still enough safety for the consumer, and we're still keeping the door open for MSMEs and SAGs to be doing some of the manufacturing and making a sizable impact.
Definitely. Thanks, Shivani. Thanks, Michael. I mean, we would have loved to spend a little bit more time on the tech specs, but we are running short of time, really sorry. But yeah, I mean, there's much more detail from both Michael and Shivani also, who provided extensive inputs to the study in the report, which is available online. So please feel free to go through that and we can share more details as available. Next slide, please. The last bit is again environmental safety. Again, this was one of Michael's points, which was key, was that there is an increasing concern around compostable products because there's lots of oxo-degradable products which are not actually compostable but breaking up into microplastics and actually harming the environment. But the validity of actually having compostable products is questioned because we don't really have suitable infrastructure for composting in LMICs. So this itself is a huge area of discussion and something to be looked at slightly more in detail, more in the report. Next slide, please. Yeah, so that's it from us. Thank you so much. I will quickly hand it over. Okay, so basically, I
think we're losing you a little bit, but I think you were going to pass it over to Sarah.
Yes, please. On to Sarah for the closing remarks, and if we can take a couple of questions after that, just to sort of wrap up the conversation.
Okay, thank you, Tanya. This has been a very interesting webinar. I hope participants have realized both the complexity of the issue around setting up standards as well as enforcing and disseminating, enforcing, and harmonizing them, and also just the level of variability that there is across the globe, and the importance of working towards standards so that we can increase method mix in this case, and informed choice for menstruators around the world. In terms of collaboration, as Soumya mentioned at the beginning, this is a joint webinar between the NERT group and the Advocacy and Accountability group. And I think you've probably heard many of the different opportunities that we have for focusing on advocacy and accountability. Certainly just making sure that we can have some quality standards in different countries and globally. And then, there were mentions of working on advocacy for small manufacturers to access the various standards, a whole range of advocacy opportunities around funding and policy development, market entry. So I hope that those of you who this is perhaps your first webinar about this topic, or you're not so sure about it, will contact. You can see on the screen the different points, people there, and then also the RHSC, and you can join us as we move forward and hopefully are increasing the number of standards and the quality of those standards for menstrual health products around the world. Thank you all for participating today. And I need to leave you, but perhaps, as Tanya said, if those who want to stay around and can have some Q&A, I think there's some very interesting questions that were raised today. So thank you very much. Bye.
Thank you so much, Sarah. Thank you so much. And we really hope to take this work forward with you and the Advocacy and Accountability Working Group. Thanks. So there are a couple of questions which we could potentially take. The first was, I think, from Adrian, identified in the process of developing these two studies over the last 6 months. And how do you see the role of government and international institutions in social awareness and marketing to ensure supply and demand for these products meet in markets across the global south? Thanks, Soumya. Yes, great to have you. I will quickly defer to Nancy, because Nancy has been, an objective participant of both these studies. Because I have been leading this, I cannot really respond to that. So Nancy, do you have any thoughts on this?
It's a great question, which I think needs thought and needs to look at both of these studies that have been so rich and produced a lot of really new, valuable information. But I guess, my first thought, Adrian, is as you've kind of alluded to, that I think that there is a significant role for governments and international institutions and all the players to be involved in this social awareness and marketing. I think that this issue of informed choice is so relevant to the access to products, as we heard in the webinar on barriers to access, and then also here in terms of standards, that if there's not the awareness, then it's very difficult to be able to choose a different product, and the awareness relates to the standards. So I think that in any way that that governments can take this on, and I think we've heard some of the challenges of that related to funding. So much of this seems to relate to the funding for this issue that has been lacking across the board. So advocacy for addressing these issues and for donors to step into some of these gaps that have been identified.
Yeah, I completely agree. I think there's space for donors to really do both syndicated funding and joint advocacy on some of these aspects, especially supporting SMEs, ensuring neutrality in some of these discussions, and the harmonization piece, of course. So lots to do there. I hope some of the stakeholders will take it on. Michael, there's one question for you. How can menstrual health products be included in the environment social governance criteria for companies?
Oh, well, the environmental piece, let's start with the environmental piece. That's obviously challenging. I mean, especially when we talk about disposable products, as the name says, they're going to be disposed, but in a lot of low and middle income countries, there is not necessarily a waste management system in place that really could work with those disposed products very well. So it's always challenging. I mean, although I'm working for a manufacturer, in some situations, it's definitely better to look at reusable products because they do not create the issue of waste, right? What was the other part of the question?
Social governance criteria. So yeah, the overall umbrella.
Yeah, I don't really know. I don't really know how to answer that question. I don't know what is looked for here. I mean, companies from a social perspective, I mean, a lot of companies try to educate, and I think that's probably a role that they can play well, especially the multinational companies, because sanitary protection, it's not only making the product available or affordable, it's also making them relevant, meaning you have to do also a little bit of education. And I think that's a role that the small scale operators as well as the multinationals can play. The education piece, saying, hey, if you use a product here longer term, this is better for your health, could be something that really is a role for manufacturers. I don't know.
And I think just participation in the overall advocacy for standards development at the country level, and then supporting enforcement later on could also be something which I think J&J in India has been doing very well. Not sure of the other countries. Danny, you want to add something to that?
Yeah, if it's all right, because I also think there's some social components that should be considered as well in the manufacturing process. And I think that when we're talking about looking at companies that reflect the values of wide-scale international development, at least for the organizations that are doing provision and procurement and service delivery in low and middle income countries, I think the role of criteria for compliance with good practices and things like ethical business practices, using green technologies in procurement, hiring local workers, building warehouses and manufacturing places in low and middle income countries themselves to help increase production capacity and things like that. So I think that there's quite a wide range of indicators that could be considered when you're looking at social impact, gender, responsive recruitment processes, childcare on site, things like this, which are, I would say, within maybe more ILO kind of standards around labor and production. I think when you're looking at environmental and social, there's a lot of these companies where I think when you look at the purchasing power of a lot of large organizations, I think the conversation that's really important between private sector manufacturers and the public sector is how do we leverage the purchasing power for our sides, making them more attractive, willing to say we're willing to pay $1 more for a product if it's meeting these social and environmental standards of the sufficient quality. How do we then work together to try and meet things like the SDGs and reduce our environmental and carbon footprint as we move forward together?
Absolutely, and maybe you could also answer this, Danny. Lucy, could image product access for employees be considered as a criteria for ESG or other good business certifications that companies seek, like B Corp?
Yeah, I mean, I think we see in UNFPA quite a lot, especially in Ebola, for example, health workers in Ebola themselves were struggling to source menstrual products, right? So we often think, especially in our own organizations, about the beneficiaries, but it's the same thing as humanitarian actors with condoms, right? It's not just, we also need to make sure that our staff are protected and things like this in different environments. So I think, yes, it's clear that the way that we see companies treating their employees is reflective of the values of the company, right? And so there's all these different kinds of standards that we can create amongst ourselves, yes, but in the end, I think it's about how do we build better business practices overall. Of course, menstrual products are just one component of that larger conversation.
Absolutely. It's an entirely, I think, from the procurement lens, that's the whole gamut of products can be looked at. Thanks. And Adrian, to your question, yes, the study did look at only disposable and reusable sanitary pads. And I do not know if there is scope to expand this to menstrual cups and tampons later, but we will definitely circle back on that. Thank you for that question, though. I think we are, I think since we are about 16 minutes above time, we will close now. And thank you everyone for joining us today. Thanks to all the panelists and the presenters. It has been really insightful, and all of those who contributed to the study, the partners who contributed to making this happen, and to all and to NERD and the Advocacy and Accountability Working Group for hosting this, because we really hope to take this work forward through at least advocacy efforts. Thank you so much. Great. And anyone who needs to consult on any aspects, please feel free to reach out to us on these email IDs that are given here.